There is real hope on the horizon. Exciting progress has been made on vaccines. Rapid and mass testing is closer to becoming a reality, and treatments and knowledge of the virus have improved. These are all grounds for real optimism, because springtime is coming. But it's not here yet. It will still be a really tough winter, and the last thing we should do now is to get complacent, just because we can see those better days ahead. So let's work together so that as many of us as possible get to enjoy those better days together. Well, look, Sharon, mass testing is one of those, I think, new, exciting initiatives. And I don't think here in Northern Ireland we should be lacking ambition when it comes to that rapid mass testing that we're talking about. The four nations health ministers got a brief on it towards the end of last week, and we've been working in the department to see how best to utilise that. The Chief Medical Officer talked about some of those initiatives that we are taking forward in care homes, in workplaces and everywhere else. But I think there's an opportunity where we could look to that next step here in Northern Ireland, where we could look at a greater population testing. It will be a large logistical challenge to try to achieve that. I've been in contact with Matt Hancock today, and again, these tests are to be distributed, on the Barnett Consequential. So what we're asking him, if he could actually forward pay Northern Ireland in some regards to the supply of some of those tests, so that we could look at a more ambitious mass testing programme for Northern Ireland.
So you were specifically talking, Minister, to Matt Hancock today about the possible introduction of mass testing in Northern Ireland, like Liverpool.
Yeah, that was we've written to him and I've been in contact with him over the past number of days in regards to mass testing and how we could utilise it here in Northern Ireland, because I think there is an opportunity, but it's how we use that and use it wisely. The Chief Medical Officer has talked, if we're not doing it across the entirety of Northern Ireland, there are a number of initiatives and a number of smaller geographical areas we could look at. But I don't want to hamper our ambition, but be realistic about the logistical challenge it would be, but not to see it as the panacea or the silver bullet for everything, because even a project like that would take time to initiate. So our actions or our restrictions are still our key armament against COVID.